At the Nuffield Trust's inaugural European Health Summit, held with support from KPMG, health leaders from 13 countries discussed recent innovations, future opportunities, and how best to respond to the major challenges facing European health systems.
Slow growth, at best, stagnation for the foreseeable future for many. And all of this will obviously translate into huge pressures on state spending. And while I think healthcare won't be the first in line for the chop, defence spending, social security might come first. It certainly won't be unscathed, which I think is probably why we're here today. Most of us are here today.
The main purpose of the Brussels-based summit was to address the pressing need across Europe to reform payment mechanisms in healthcare.
Many more countries are now considering really more innovative forms of payment, bundling across pathways, that means across settings according to where patients are treated, and thinking much more carefully about the quality that they are paying for. So paying for more where there is extra quality, or withholding payment where there is less quality.
The event explored the importance of achieving better value in healthcare and international approaches to securing financial sustainability.
Well, at the moment we just buy the individual components priced at the average price, and there's no real assessment of whether we're buying either the right thing or the thing is done right. So I think people are trying to shift their payment design systems to buy what looks like value to the patient, but also what looks like value at a population health level. So rather than just buying individual components, people try and look at the entire product, if you like.
The bad news is no country in the world has got the optimal solution yet. The good news is there are more similarities than differences in global healthcare, and conferences such as this really do help spread learning, share learning, and I hopefully also think that we'll develop deeper insights into some of these pernicious problems.
Health leaders heard about two payment systems being experimented with across Europe in an attempt to extract greater value. The first was the introduction and impact of diagnosis-related group or DRG payments.
The main impact of this payment system is that the policymakers, the purchasers of healthcare know much more what hospitals are doing. So the transparency is really up. The second effect we see is that the efficiency, so what the hospitals produce in terms of cases and services for patients for the money received, has also gone up.
The second trend in payment system reform explored at the event was the growing use and development of pay for performance.
I think the point that we were getting at today was that the whole payment is for performance. And we need to design these basic payment systems in the case of hospitals based on DRGs. How we use the DRG and link DRGs with a number of quality incentives, guidelines, regulation.
The 2012 European Summit, held with support from KPMG, reflected on the possible lessons for the European community from such international innovations in its pursuit of high-value healthcare.
I think we were all rather sobered by the fact that although this is a very complicated area, we don't have much time in some countries to make the changes, and therefore we're really going to have to accelerate and be bold and be more radical. And then the other part here is that the researchers also have to step up to the plate in developing more rapid forms of feedback on the impact of some of these changes.
Look out for updates on the 2013 European Summit via our website at www.nuffieldtrust.org.uk/talks.